Omaha native and Baseball Hall of Famer Bob Gibson has been diagnosed with pancreatic cancer and is getting treatment at Nebraska Medicine. Pancreatic cancer is a fast-moving and deadly form of cancer, and researchers at UNMC are some of the leaders in its field of study. Reporter Phil Bergman went out to learn more about the disease and the work researchers are doing.
Run average this year.
Omaha legend Bob Gibson is back on the mound. But instead of facing a batter, he's looking to strike out pancreatic cancer.
This is a tough cancer. I mean, any cancer is tough, but pancreas cancer is particularly difficult to treat.
The pancreas has two main jobs: digest nutrients such as protein and fat, and to regulate insulin. Located near the abdomen, cancer symptoms are nearly impossible to detect.
It's very fatty, it gets irritated or inflamed really easily, and sometimes it can be hard to see even a 1 or 2 centimeter tumor in the pancreas, even with those scans.
Most patients are diagnosed with the disease when it's already at stage 4. Symptoms are seen around stage 3.
For the general population, we don't recommend screening, basically because we don't have a screening test that's good enough to diagnose pancreas cancer in someone who's not at significant risk.
Unfortunately, pancreas cancer is one of the toughest cancers to detect early. Researchers here at UNMC are on the cutting edge of trying to find a cause for this cancer early.
There's a lot of evidence from some recent clinical trials that actually if you detect it in the earlier stages and give chemotherapy early, for example, even if the disease is already metastatic, that the patients can live longer.
Tony Hollingsworth is one of the researchers. He says they've latched onto a biomarker called C19 as an indicator for cancer treatment success.
So it turns out that when the cancers develop and progress, they make things that get secreted into your blood. They're called biomarkers. If the disease gets worse, this marker goes up, and if it gets better with treatment, then it goes down. So that's a good marker for tracking the progression of cancer.
Pancreatic cancer research still has a long way to go. The 5-year survival rate of the disease is 9%. But if researchers can find a way to catch the disease early, there may be a way to cure it in future patients.
The more we can detect it earlier, the more chance we have to really treat it earlier, and I think the more cures we'll be able to have. Certainly we'll be able to extend the lifespan of patients by doing that.
Reporting in Omaha, Phil Bergman, 3 News Now.
UNMC is also home to a rapid autopsy program. Basically, it's a pancreatic cancer tissue library where researchers from across the country can check out tissue samples to do their own research on finding a cure for pancreatic cancer. Researchers also say they want to look more at immunotherapy and its relationship with pancreatic cancer.